Well, like I stated previously, my name is Juanita Garza, and I am a licensed professional counselor and a certified trauma-informed care practitioner and trainer in Colorado. I work with Griffith Centers for Children, and we have several offices throughout Colorado. One thing that I am blessed to be able to do are these trainings. So, trauma-informed care. Why do we think it's important?
Because our teens are traumatized.
Because the teens are traumatized? At first I said your teams are traumatized.
Well.
That is why trauma-informed care is important. So basically with Griffith Centers for Children, the powers that be got together and decided they were thinking about what they could do to help our clinicians, further help our clients. The majority, if not all, of the people that we serve have been through some type of trauma. Now, there are different levels. And because we think differently, we're going to have our different thoughts about what trauma is, or maybe what our definition is. But we have to be really careful when we work with patients or clients, because something that we might not feel is traumatic, they might have gone through, but it is traumatic for them. So, if that makes sense. So tell me what your definition of trauma is. Usually I do it a little bit differently. I wasn't able to get my stuff out and pass it around because usually it's in a bigger spot and we do a different activity. But we're just going to kind of do this one as a whole. So what do you think your definition of trauma is?
So like when people are in an incident that feels threatening or life-threatening or threatening of their bodily autonomy, and maybe that incident stays with them in recurring thoughts or intrusive thoughts or flashbacks or nightmares, and because of like maybe the heightened adrenaline or whatever of the situation, creates like maybe a change in brain chemistry or a change in response to environmental factors that in the future remind them of that event in whatever way.
Nice. So say we're in here and we're doing this training, and a nice big 8-foot grizzly bear just comes to that door. What are we going to do? We're going to panic, yes.
Bust through that wall right there.
Probably. Because what happens when we're faced with trauma or triggers, what part of the brain goes off?
The amygdala.
Your amygdala. What does it do?
Fight, flight, or freeze.
Right. So it's telling the rest of the brain, release these chemicals. What chemicals are released?
Adrenaline, cortisol.
Exactly. Epinephrine. So those chemicals are meant for short-term events. For our body to constantly be flooded with those chemicals is not a good thing at all. So basically, for like an infant, they either recognize distress or shock. There is no trauma. The brain is not able to recognize trauma at that point. So in utero, or up till about a year of age, if a child is constantly being triggered, what happens to the HPA axis?
It gets really sensitized to everything.
And it gets permanently activated. Do we know what the HPA axis is?
No.
I know you know. I know you know.
No, I can't. I don't.
Hypothalamic?
Pituitary adrenal.
Yep, exactly. So basically, when the HPA axis is permanently activated, sometimes when the kids are smaller, we don't see a lot of the behavioral issues that may come about until they're school age. Because when they're school age, a lot of the one-on-one's not there anymore. That focus that can be on them and redirect, right? So if these children don't get the proper help to be able to learn to live with their HPA axis being activated permanently, then there's a lot of trouble that happens later in life. Okay, does that make sense? HPA axis is very interesting. Look it up. How many of you have heard of adrenal fatigue syndrome? Nice. So how many of you know when trauma-informed care kind of started being looked at? Like they noticed kind of a trend.
In the 80s, maybe?
With who? What population?
Like combating rape victims.
Mm-hmm. Exactly. You've done your work. Nice. What's your degree in?
Psychology with a minor in gender and sexuality studies.
Ah, so you're going to become a trauma-informed care practitioner? I think you would make a good one.
Master's this fall.
Nice. Very good. Awesome, awesome. Hi, welcome. So trauma-informed care recognizes symptoms as originating from adaptations to the traumatic events or context. Validating, oh, you heard that Oklahoma accent, validating resilience is important even when past coping behaviors are causing problems. Understanding a symptom as an adaptation reduces a survivor's guilt and shame, increases their self-esteem, and provides a guideline for developing new skills and resources to allow new and better adaptation to the current situation. So in my opinion, doesn't necessarily have to be your opinion, okay? But in my opinion, one of the most important things in that paragraph, it's all important, is self-esteem. Why would self-esteem be important to target?
Because it's tied to your self-efficacy.
Mm-hmm.
And that kind of drives you, right?
Mm-hmm. It does. So if someone's self-esteem is down here, and you can be that one person to get through to them and help them on the road to recovery, if you can get that self-esteem up, what will you see? Increased resiliency. What else? The R word. Very good. That's a conversation. Usually this is a 4-hour PowerPoint, but we only have a limited amount of time. Don't know if we're going to get to that conversation, but it's interesting. We'll get to the slide for sure.
Empowerment.
Yes. Empowerment. What else?
Self-calming.
Mm-hmm. Yep. What else?
Better well-being overall.
Mm-hmm. What about motivation? Without motivation, what happens? Nothing. And do you know how many times I've heard, not from clients that I've come in contact with, but I do consultation and supervision with other clinicians. And sometimes even in Oklahoma, I worked there for 15 years, even in Oklahoma, you would hear a lot, you know, I've been through 7 therapists, or I've been through 12. What are you going to do for me? So what we have to figure out is, what do we have to do different? So one of the activities that I usually do with people is we write down the word trauma, and we each put a word with each letter, and then we go around the room and we put it on the board and we go through it. What's crazy is that the trend, except for a few times, all these trainings that I've done, the trend seemed to be the bigger the group, the more negative words that were on the board. Okay, but it's not our fault. That's how we have been taught. I've done this for almost 18 years now. So one of the importance for trauma-informed care, and one of the reasons that Griffith Centers is doing this, is because we need people to look out of the trauma lens. Because if we look out of the same lens that everyone else has, we're not going to help. We're going to be number 8 or number 13 on the list. Doesn't mean that those previous clinicians were terrible, horrible clinicians. No, not necessarily. It just means something didn't connect. But that is the one thing, one of the most important things. Before you can do any of this, you have to make that connection. Have to. There just really is no other way to get through to somebody if you don't. We are social beings, are we not? Okay? We're not meant to be alone. Now, having alone time is different, but we're not meant to truly be alone. And those that normally say, I don't need anybody in my life, psh, I don't need anybody, I'm fine by myself, are the ones that need people the most. But the thing is, they don't need 50 people, just one. And each one of you guys can be that one for these kids or adults, whoever you tend to serve. Because we are social beings. We tend to flock to people that have gone through similar situations, right? Empathy, sympathy, those types of things. Is that right? You think? Trauma or exposure to toxins during the prenatal period can impact later childhood development. Some dangers include prenatal exposure to drugs, toxins, and disease. Maternal stress can affect fetal development, including an increased chance of cleft palate, depression, attention deficits, and distractibility. Stress hormones released by the mother can also reduce the placenta's ability to protect the fetus from stress hormones in the future. So, we always tell women who are pregnant, don't stress out. Don't stress out. The baby can feel it, right? And what happens in utero and up to a year when a child is exposed to constant triggers or traumatic situations? That HPA axis. There it goes. These are the children that have problems sleeping, problems focusing. These are adults that never got the proper help that they needed before. They have trouble sleeping. Their mind never stops. Now, am I saying every adult or child that has, I guess, situations like that where their mind doesn't stop or they have issues sleeping have had traumatic experiences? That's not what I'm saying, because I never say anything 100%. But that HPA axis is very important. Okay. So, because I feel these two video clips are very important, I'm going to go ahead and play the first one. And then we'll see what you guys think. I cried the first few times I saw it. It's just, and it's powerful. Why do you think it's so powerful?
She's a child. Yeah.
Because why?
She's a child, for one. And for two, this is something that happens. And for a lot of us, we have, I mean, I can't speak for people, but I can definitely predict that we have people in mind that something happened so close to this that it hit really close to home. Mm-hmm. We felt it.
Mm-hmm. Oh, yeah.
The filmmaking holds really tight to her perspective, so it's like you're put in a point of view that you don't often get
From the child.
From the child.
Mm-hmm. Yep.
And you just see that cycle of like hurting people.
Mm-hmm. So awesome. Good answer, guys. So in the first clip, there's one particular scene that I always key in on. What do you think that one is? There was several of them, but...
Is it the one where her foster mom tries to give her the gift and it triggers that experience for her?
That's one of them. That's one of them. That's usually like the second one that we talk about because of triggers and stuff. But what about when the police were there?
Yeah, taking the two children apart.
Taking the two kids apart, but what happened before that?
She started running.
Who did the mom chase?
The man.
Yeah.
Why? The abuser.
That's typical.
Why is it typical? First of all, that cycle hasn't been broke. But why? Why was it so important that she go after him and not her children?
If it came to where he came back and she didn't try to save him from that situation, he could hold that against her.
That could be one. Yep, definitely. What else?
Maybe some codependency.
Mm-hmm. Mm-hmm. What about like financial? Mm-hmm. What if he's the one that financially provides? Very good. So the other one...
You could also say the children were accidental and didn't matter to her as much as the adult relationship. She shows that later.
Mm-hmm. She shows that they mean that to her later, or
that she hadn't really invested in those relationships.
Okay.
And particularly the girl registers that throughout.
Well, and how did you feel when she says, well, you're all grown up?
Like your baby.
Exactly. Exactly. I mean, and that's another one that hits people because a lot of times, like in bigger areas, I can like go back to the room and kind of see everyone watching it because I like to see kind of how, not that I want to cause trauma to people because that's not what I'm trying to do, but I like to see reactions.
Another part that hit me really hard was after the dress, because I had expected that, but then when the foster mom was on the phone, I was like, oh, this is another person that, you know, she had said if she pushed hard enough, you know, that they would be pushed away, and I thought that's what was going to go on there, that she was like, I can't take it anymore, and so that was hard.
And that's true because it could go either way. One was that situation or the other is what happened. She ended up fostering the brother. So, and then who advocated for her? Her foster mom. Do you remember what the foster mom told that doctor when he was giving her medication?
That she didn't need medication.
And what did she need?
Therapy, more time with her mom.
And more time with her mom. Because I'm not saying medication can't help things, but medication is not the fix all. So can you heal somebody in 28 days? Can you heal somebody in 60? Can you heal somebody in 90? But yet we put people in programs, 28-day programs, 60-day programs, 90-day programs, 6-month programs. Treatment is needed, but that's not the only thing that's needed. Treatment is a part of healing. And if we don't help people heal, we're never going to get them to the place where they need to be. So to me, it's kind of like a triangle. You have trauma at the top, treatment and healing here. It just kind of all goes around. But if you've got to get to that healing point in order to see any type of lifestyle differences. You know, put that glue on that vase all you want to. Eventually, stuff's going to start seeping out. One way or another. That's trauma-informed care. That's what we're trying to do, is go further and find out what can help survivors of trauma. Okay? How do you think your first interaction with this child would have been? As a big brother, big sister, as a therapist, as a clinician. What do you think, what would your expectations be of her?
I would not expect her to move towards me, like as a clinician or as an adult person in her life.
Why?
Because like she said, she's had like many promises broken, and I would expect a lot of distrust and sort of like the need for a lot of time to build up any sort of trust with her.
Right. Very good. Good answer. Because that's probably what's going to happen. You could be the nicest, most gentle person on earth. And because that child has had so much happen in her life, so much trauma, and moved from place to place, starts all over again, just like she said. And everything's out of control. So she's going to control what she can control. And that's basically she's going to let in. So I'm going to have you guys do an activity. The one thing that I believe the most is language and approach. If we continue to use the old language in this field, we're not going to get anywhere. If we do not learn how to approach traumatized survivors, we're not going to get anywhere. So, on this particular activity, what I want you to do is I want there to be, had to do some math, 2 groups of 4 and 1 group of 5. I want a person from each group to grab a board, an eraser, and a marker. So however y'all want to do it, doesn't matter. Y'all can count off. Y'all can pick your own groups. It doesn't matter. And then as soon as you get into your groups, I'll let you know exactly what I need you to do.
Can you just do like sides of the table?
There you go. And y'all, some of you might want to move into the other room if you want, if there's going to be too much noise for you to think. So what I want to do, each group is going to get, actually, if you would take one and pass one to everybody. And we'll just do it that way to start with.
Thank you for asking. Josh, excuse me?
What was the movie called again?
Removed. Removed. And then I think it's Removed Part 2, Remember My Story is the second part. It's actually a full movie, I believe. So, okay. So on this sheet of paper, this column right here is old language. Okay? This column right here is the new language for that situation. What I want you as a group to do is I want you to come up with another new positive language for that scenario. So my first group, I want you to take the first 3. My second group, I want you to take the second 3, and my last group, the last 3. And I'll give you guys some time to do this. The first group to take the first 3. Yeah. Second group, second 3. And third group, last 3. Okay. I know we may look at some of these examples and think, how in the world can anybody ever say this to somebody? But I guarantee you it's been said.
Because they're mean.
Is it because they're mean or they're just uneducated?
Yeah.
Some of both sometimes.
Some may be mean. This is also another reason that we're doing the trauma-informed care is for awareness. Because the more aware you can be, especially in this field, the more you can help others. Not only does it help yourself, but it helps others, okay? So, first group number 1. The first thing is this person is sick.
We said this person is overcoming daily.
Nice. Very good. Okay, so the second one said they are weak.
They're not weak.
By golly, with a bunch of exclamation points. I want her as my therapist. You are not weak. They are. No.
And part 2 of that is they are discovering their strengths.
A part 2. Nice. Very good. Awesome. Awesome. I've never had a part 2, I don't think. Do what?
I should have read that one first. That's the real one. This is the part 2.
This one, I'm sure, is very common. They should be over it already.
They heal a little bit every day, or this person is on a journey towards health.
Very good. What kind of health?
Social, mental, emotional.
All of the above.
Oh, very nice. Very nice. Good job, guys. Okay, group 2. Can you top them? You're not weak. You're not weak. No. So the first one is they're making it up.
They're trying to say something. There are real feelings behind this.
Nice. I like the word real. Because here's the thing. We all grow up in different places. We all grow up in different cultures, even in the same nation. Doesn't matter. Okay? So all of our perceptions may not be the same when we have lived through a situation or when we've seen a situation. Okay? Just because someone hasn't gone through the trauma doesn't mean they're not a trauma survivor. Okay? They could witness it as well. So, what number 1? Oh, they want attention.
They want to be heard. They need someone to listen.
Nice. How many of you have heard people say, "Oh, they just want attention"? Their neglect wasn't that bad. At least they had one meal a day. You know. Don't ask them about it or they'll get upset.
They need the opportunity to talk about their trauma.
Very nice. So one particular population that I think about in that particular scenario is when a suicide happens. A lot of times we avoid that conversation. Why?
Make them uncomfortable.
Does it make them uncomfortable or us uncomfortable?
Sometimes they think like it would make someone else uncomfortable, so they don't talk about it.
Okay.
And I mean, someone could avoid it because I would hope not in this field, but I mean, outside, I feel like people avoid that conversation if they feel like they see someone who's struggling and may think that because it's not easy to talk about for them.
Right. Right. And sometimes if they think it's going to make someone uncomfortable, then we assume, oh, it's going to make them uncomfortable. So it's kind of like that unsaid conversation. We're assuming, and that's going to hurt that relationship there. Because, I have a friend that went through this personally 3 years ago. And it was her son. And she just constantly had to talk about it, talk about him and talk about things that he did and just all of these things. And I know some people thought that she should have been over it by now. So, and these were people close. So I think it's just a lack of education, a lack of awareness. There is no timestamp on grief. I mean, there is not, you cannot, it may take someone 6 months for a certain situation and someone 60 years for one. It depends on that person. What do you think about the saying, time heals all wounds?
Nope.
No.
I heard no.
Nope.
Okay. Any other thoughts?
Depends on the person, depends on their chances to talk about it. And it really depends on what happens afterwards.
So it kind of depends on what you do within that time.
Yeah.
With time. Very good. Good answers.
Like time gives the opportunity for healing,
Right.
but maybe it's not passive.
Well, I think wounds leave scars sometimes, Like, I know losing people in my life, like, I'm different forever, if it's not.
Oh yeah.
I won't be the same as I was once, it's,
Right.
yeah.
Just like a different take on life after that.
Yeah, exactly.
Yeah. Very good. So are we done with group 2?
Yes.
Good job, guys. Group 3. We got a little tidbit in the beginning. So they have poor coping methods.
Us, this is the problem, but to them, it's the solution.
What you think? I like the way she voiced it.
I knew you were
What you think? All right. What about they'll get over it?
They have untapped superpowers.
Ah, nice. Would we use this more towards children or adults? It would depend, right? It would depend. I think we all need to be kids at heart. Now, this one has definitely been said. They are permanently damaged.
They just need room to grow.
Very good. How would you feel if you overheard somebody talking about your situation and that's what they said?
You have to leave the room.
It really takes away the autonomy of the person who's been hurt.
And when you hear the word damaged, That's a powerful word. What do you visualize? I want you to close your eyes for a second. When I say the word damaged, I'm going to go around and I want you to tell me the first thing that you saw. Okay? Josh, we'll start with you.
I saw a rain damaged painting on the side of the road that nobody wanted.
Interesting.
A totaled car.
Okay?
I also saw the car.
Oh, what? I'm sorry.
I also saw the car.
Oh, okay. Gotcha.
A scarred face.
Okay.
A heart.
Okay.
Me?
Sure. Behind the pole.
A crying person.
A what person?
Crying.
Oh.
I saw the hammer to the wall, kind of destroying the wall.
Shattered glass.
It's like a huge polluted body of water that was yellow and green and oil sitting on top.
Wow.
Like a chipped or broken china plate or something. I saw the totaled car.
Wow. Okay.
I also saw a car, but I just saw like a fender bender.
So her trauma has been worse than hers. No, I'm joking. So those are some pretty detailed visuals, and that was just that quick. So again, I'm going to say language and approach. How far you're going to get with somebody is going to depend on the type of language and the approach that you use. There are some people out there that are not as educated as we are, and they think, here's this 10-year-old, talk about their trauma, man, they've been through so much, but they won't talk to anybody. What do you do with that? What do you do with that child? Because by golly, their caregivers or whoever they're with thinks it should be fixed in a month. Or let's stick them on some medication and they'll be fixed.
That's a better solution for sure.
That's what all people think, huh? I love that part where they're in the doctor's office and the foster mom's like, that is not what she needs. And if we had more people out there that would say that for some of these kids. How many of you guys have followed the developmental trauma trail? There's a lot of research going on with that. Bessel van der Kolk is behind a lot of it. Amazing man. Research it when you get some time. Research it when you have some time. He wrote the book The Body Keeps Score. Mm-hmm. He's very interesting. Bessel van der Kolk.
There's a couple copies at the house. Is there?
I have it on computer.
It's very interesting. They're looking a lot at developmental trauma between 0 and 3, 0 and 5.
I think that would help so much too if that was taught more or presented.
Yes,
Because it gives such a foundation for trauma.
it does.
Much better understanding.
Yes. And the thing is, there are so many people out there that I've heard say, or someone told me, I was told to adopt a kid through DHS or through the state before the age of 3 because we're not going to have any issues. But then they get a 2-year-old and then a couple years later, they're seeking services because this 2-year-old can't focus, doesn't sleep through the night, all these issues that are going on. Even some people that have had these children from the hospital, adopted them from the hospital, basically, from day one. And these issues come out because it's developmental.
Pre-verbal.
Say that again?
Pre-verbal.
Yes, ma'am. Yep. Developmental trauma is very interesting. Do you know why neglect is one of the hardest traumas to treat? not graspable.
So it's like an absence.
It's kind of like, yes. Yep. In your slides, we skipped it because we're trying to get through some of this stuff, but in your slides, there's one that said never judge a book by its cover, and there's a saying that's with it. Basically, the meaning behind it is just because you can't see it doesn't mean it's not there.
I think Gabriel Monte says that there's two different kinds of trauma, one where bad things happen and one where good things don't happen. And that both can manifest as trauma.
He's pretty brilliant too. He is. He is. Do what?
No, we need you here.
Let's all move to get into that. That's funny. I was just talking about that on the way up here today. Not that I'm going to move yet. No. So we have maybe 15 minutes, so we're probably going to go through a few things pretty quickly. If you look on the National Child Stress Traumatic Network, the NC, I always get those letters mixed up. But if you look on there, you can get a copy of the 12 core concepts in childhood, how children handle trauma. It will give, usually in the packet that I give, I wasn't able to do it for you guys today, but in the packet I give just a briefing of the 12 core concepts. But in that you can download, it explains them in detail. Very interesting. So something I forgot to tell you guys is, in 2011, out of 6.2 million children, there were 3.4 million reported abuse and neglect cases.
Are those included repeats?
I was wondering the same thing. Have not found that yet, but I'm going to try to find out. And that's all that was reported. What about the houses that what happens here stays here? Or this will happen to you if you go and say this. So that's over 50%. That's a lot. We need to change our lens. We need that trauma lens. We need to help people understand that these kids, these behaviors they don't want to be like that. They don't. We need to help them. We also need to help the caregivers understand that it's not an overnight process. Chronic stress decreases the body's immune system's response to infection and can affect a person's response to immunizations. Did you know that?
Maybe the first part, not the second.
Yeah.
So you know how some people say, oh, when I get the flu shot, I always get sick. How many of you guys have gotten sick from a flu shot? Y'all have? It's interesting because people I talk to, it's like 50-50. Some people don't and some people do. I don't know if maybe because you've gotten sick one time that stress maybe builds up, or that worry builds up that you're going to get sick off of it again and just something happens. Notice the time in your life that you take them. Were you under a lot of stress? You know, those are things to think about. But yes, it does affect your response to immunizations. But I thought that was very interesting. Post-traumatic stress physically changes children's brains. Specifically, stress shrinks the hippocampus, a part of the brain that stores and retrieves memories. When trauma happens, what happens to your prefrontal cortex? Goes offline. It's gone. So that 6 or 8-year-old child that's in the corner that got triggered by something, throwing a fit, and we're telling them, you're not going to get recess, you're not going to get this, you're not going to get your snack this afternoon, do you think they care? In the 12 core concepts, you'll learn it's danger and safety. Children feel they're either in danger or they're safe. So do adults.
Is that kind of where like repressed memories comes from, or suppressed, repressed, one of the two?
From the prefrontal? Or just...
Yeah, just like in general, just like the stress of it. kind of.
You know, some people that I've worked with and some people I've talked to, it's like they've lost memories, but then some people, certain memories are a lot sharper. And I don't know if it's just due just to the difference in our individual brains. Not sure about that. That's a good question though. But I've had it both ways. But that's what happens when you become triggered. So your amygdala starts, your smoke detector starts going off. I'm sensing smoke. Here I go. I'm out. There's your prefrontal cortex running. That's where you make your decisions. So of course, if you're triggered or if you're in a traumatic event, the only thing that you're going to think to do is what? Survive. Fight, flight, or freeze. Right? Just like I said, if that grizzly bear came to that door today, we'd go. If I came back next week, trust me, in the back of my mind, I'm going to think that grizzly's going to show up again. Although he's contained in a zoo somewhere, doing just fine. But because that was traumatic, it's still going to be there. Someone could walk by in like a brown jacket, looks like a bear, and I could get triggered. Trauma is something else. It really does some work on the brain. It really does. An early record of post-traumatic stress syndrome dates from the 8th century BC in Homer's Iliad, when Achilles suffers severe battle stress in the Trojan War. Achilles complains of feeling emotionally numb or dead and expresses suicidal thoughts and rage. When cells shrink due to exposure to stress hormones, they disconnect from each other, which contributes to depression. But by golly, we can fix it, right? Psh, depression doesn't exist. Just, there you go. Exactly. In your slide sheet, you have the types of trauma. Oh, I wanted to go back to that one real quick. Sorry. So it talks about the frontal cortex, the social and emotional center, open to change throughout lifespan. Your amygdala is your fight, flight, or freeze. And your hippocampus is your short-term memory, cause and effect, and your cortisol. Cortisol is not a good thing to constantly have running through your system. So I want you to think about the word resilient or resilience, however you want to say it. And I want you to read that slide. So after seeing that slide, does your definition of resiliency, resilience, or resilient? Oh, yes. So this is how stress changes a brain. And this is a comparison of 3-year-old children, 2 different brains, normal and extreme neglect. Prolonged exposure to trauma triggers physiological changes in the brain. Neural circuits are disrupted, causing changes in the hippocampus, the brain's memory and emotional center. This can cause brain shrinkage, problems with memory, learning, and behavior. A child does not learn to regulate emotions when living in a state of constant stress. How can they? If you keep going to this place, you can never regulate yourself. They cannot regulate. Associated with greater risk of chronic disease and mental health problems in adulthood. So does your definition of resilience stay 100% the same before you read that? How do we bounce back from this?
Someone who's willing to be patient and help those parts of the brain like work functionally, where they're able to have the time to process emotions, have the time to process their, how they regulate their behaviors and, their impulses and whatnot.
Right. Patience. Big key. Because you may get somewhere in 6 sessions, and come the 8th session, you might be right back to the first session. But we don't give up. We continue. Because you can bounce back from that. Resilience does exist if the proper help is sought after. and is found. So we are the ones, we have to be patient. Because we're not only trying to help the child, but we help them, those around them, correct? Because child can't be the only thing that has work to do. That environment is going to have it as well. Or what we're doing here, we're taking them and putting them right back in it. So people who have experienced trauma are 4 times more likely to become an alcoholic, 4 times more likely to develop a sexually transmitted disease, 4 times more likely to inject drugs, 3 times more likely to use antidepressant medication, 3 times more likely to be absent from work, 3 times more likely to experience depression, 3 times more likely to have serious job problems, 2.5 times more likely to smoke tobacco, and 15 times more likely to commit suicide. This is what's going to happen if we don't become trauma informed. And again, that's just what's reported. So why do you think they're 4 times more likely to develop a sexually transmitted disease?
Riskier behavior.
Exactly. Riskier behaviors. PTSD, how I feel when I get triggered. My heart beats like crazy. I sweat. I feel hot. But my feet and hands go cold and I can't think. I feel like my throat tightens and my mouth is dry. I usually freeze. I get tunnel vision. I can't speak and I'm afraid, real afraid. My brain shuts down and sometimes I dissociate immediately. And it's the most exhausting and terrible thing even when the immediate stress response is over. It's impossible to just go back to normal. But by golly, we can fix it. PTSD doesn't exist, right? A lot of people out there believe that. I feel they're wrong. A list of your PTSD symptoms. I don't know about you, but just a few of those make me nervous and anxious and anything to add to that one? Or you think that kind of covers it? It exists. Stress can increase the ability of chemicals to pass the blood-brain barrier, which shields neurons from some poisons, viruses, toxins, and other fluctuations in normal blood chemistry. Laughing lowers stress hormones like cortisol, epinephrine, and adrenaline, and strengthens the immune system by releasing health-enhancing hormones. The stress hormone cortisol not only causes abdominal fat to accumulate, but it also enlarges individual fat cells, leading to what researchers call diseased fat. Chronic stress floods the brain with powerful hormones that are meant for short-term emergency situations. Chronic exposure can damage, shrink, and kill brain cells. What do you think? We need to laugh. A lot. Laughing good, cortisol bad, long term, no. You guys have any questions, concerns, comments?
I'm kind of curious, so that last part about it, like damaging, shrinking, killing brain cells. I know our brain cells have ability to regenerate, but I imagine that the ongoing stress would decrease that ability as well, or something I would think, or I guess that's my curiosity there.
Like, if you were trying to,
Yeah.
say trying to get therapy or trying to get help, but the stress is continuing, is that kind of?
Or I guess like Yeah, I guess at what rate would the stress have to decrease if someone was now in like a safer environment where they're trying to, rebuild that what's been lost?
It takes time. It takes a lot of time. It does. Because you have to think how much time it took to get to that point. But those neural pathways can be formed. Just like they say, if you're around a lot of negativity or constant negativity, that starts to form neural pathways in your brain, and that can cause a lot of negativity to happen in your brain as well. And you just kind of become the company you keep. I know that's an old saying, but in a way, I mean, that's kind of how people are looking at it. So you guys need to have friends and family that are just funny and laugh all the time. So,
Yeah. So, I guess I'm curious what therapeutic techniques Griffith Center uses sort of therapeutically to address trauma. Like, do you guys do like EMDR or like repeat exposure or more CBT, or what are your
we do
standpoints?
TFCBT, we do EMDR, evidence-based, lots of evidence-based, which that's the one thing I like Bessel van der Kolk, because he's not afraid to say that something's not working. You know what I mean? He would say, okay, this isn't working. Okay, let's go to this because it's showing signs that it's working. So, but yeah, lots of evidence-based. EMDR, definitely. TFCBT.
Are those the main two that your center uses? You say like the two main like therapeutic standpoints?
EMDR is a little tougher to find because people have to be trained and certified in it. So, I mean, it takes a lot of time. So it's kind of hard to find people that are trained in that area. But yeah, the cognitive behavioral, solution focused, those types of things. Yeah. But EMDR is very interesting. Very interesting.
Magic.
Though some think that it is. And it may be. I appreciate you guys having me here tonight.
Thank you.
And appreciate you guys working with in here in this space. We were going to be out there, but because I had to show the video and clips, they helped me get set up in here. So thank you guys for your flexibility.
Thank you.
Thank you very much.
Thank you guys. Y'all go out and laugh a lot. Laugh, laugh, laugh. A lot.